Thanks very much for the invite to be here. I'm going to try and be fairly brief about my overview, particularly of the two areas for which I have responsibility, mental health and ageing, to maximise the time for collaborative discussion. I think it's fair to say, because I know Nicola hasn't been here this morning, I think it's fair to say before I get to mental health and ageing that workforce questions are at the centre of our entire health reform agenda. I think you've heard from Health Workforce Australia, but there are a number of challenges we see ahead of us in the health system, and some of which we're dealing with now. Things like the ageing of the population, how to deal with an older cohort of Australians needing health support and health care, the growing incidence of chronic disease, a number of them particularly prominent, but how to sustain a high quality workforce to do the work of that healthcare system is really one of the few major macro challenges we have, and you'll see it really that question riddled through everything that we do in health reform. There are the question of numbers, sheer numbers. This is one of the areas of the workforce where you can project very significant growth into the future, while a whole lot of our traditional industries are shrinking or in some cases even disappearing. But it's also about distribution, and that is a very significant challenge on urban fringes and in rural and regional Australia, as all of you know. Last week or the week before, as a couple of you have particular interest, I released the evaluation of the Better Access program, for example, a 4-year-old program that provides Medicare rebates for allied health professionals like social workers, notice I put them up the top, Candy, social workers, occupational therapists and psychologists delivering psychological counselling service, able to attract MBS fees. A couple of things were notable from that evaluation. Firstly, that it seems to have achieved its objective, which is to lift the treatment rates of people with high prevalence disorders like anxiety and depression. It appears to have achieved good outcomes on the basis of the consumer surveys undertaken through the evaluation. But like a whole range of MBS programs, it has its challenges in terms of distribution. Now, you can cut that a range of ways. You can cut it by age, and access for young people to mental health services, as you know, is incredibly important, given that 2/3 of mental health disorders emerge before the age of 21. But rural and regional Australia do relatively poorly under this program, and lower socioeconomic areas do relatively poorly. The highest quintile, so the richest 20% of Australians, accessed in 2009 2.5 times the number of better access services accessed by the lowest quintile. They attracted $150 million of Medicare funding for those services, compared to $50 million of Medicare funding for the lowest quintile measured socioeconomically. So there is a distribution question in better access. As we know, there is a distribution in a whole range of the demand-driven fee-for-service programs, and that's an ongoing challenge for us. My areas, I'm happy to say, are two areas identified by the Prime Minister as areas of priority for this term of government: mental health and aged care. And I thought I'd give a very quick overview of that before taking questions. Mental health at the moment has an extraordinary level of awareness, consciousness, and for that reason, expectation in the community. Research that King's College did across a number of countries last year, done through Ipsos research, including surveys of over 1,000 Australians, asked people across those countries to name the 2 or 3 things that most concern them about their country. And every country named the economy or jobs in some description, and climate change or global warming in some description as the first 2. But what was unique about Australia was that 35% of Australians nominated mental health. It came number 3 on the list. The average across the world was 10%, an average lifted significantly by the high rate in Australia. But I think a very clear reflection of what we know, which is that last year, particularly through Pat McGorry's time as Australian of the Year, an underlying sense of unease that people have had for years in this country about how we deal with the needs of people experiencing mental illness in their family got a shape and sense of legitimacy it hadn't had before that. For that reason, I've been appointed as Mental Health Minister. I've been given the job to prepare some options for reform for the Prime Minister and the Cabinet. And I think we've seen through that process over the last few months, as people who work in this field readily understand that this is a very complex area. This is not a traditional health area. This is an area where the housing and employment and family attachment needs of people experiencing mental illness are just as important, sometimes more important than the clinical service that health professionals and GPs are able to give. So coordinating those services and wrapping them around the person rather than expecting the person to enter 10 or 11 different doors to talk to 10 or 11 different government agencies is absolutely at the core, I think, of the reform effort that we want to undertake over the next little while. Part of that work, I think, particularly for adults with severe and persistent mental illness wanting to reconnect to the core tenets of society like work and stable housing and social relationships, is peer support workers. And I think the work that your organisation has done in this area has been incredibly important. As I go particularly around and visit FAMS services, the Personal Helpers and Mentors program run by FAXIA, all of them have peer support workers. All of them are utterly central to the operation they've done, and a very important reason why that program, which is also only about 4 years old, has been evaluated so positively and achieved such good results. The other area is aged care that I have responsibility for. I have ageing, but broadly speaking, that's an aged care portfolio. This is, because of the ageing of our population, obviously, an area that is going to only grow in significance in every sense of the word. Its impact on the labour market, its impact on the health spend, its impact on the economy. These are all good things because they all result from the fact that people in Australia are now no longer dying in their 50s as they were 100 years ago. That is something that we should celebrate while recognising that there are a range of economic and employment challenges that come with this. In the employment area, for example, there's about 260,000 people working in aged care now, and we expect that number to have to triple over the next 40 years. Now, there aren't many significant areas of the labour market that are going to triple over the next 40 years. This is not an area where I can imagine great technological leaps leading to the need not to employ personal care workers unless we leap forward to some Jetsons type environment where we have robots toileting us, God forbid, and showering us and feeding us. This is an area where there is an inexorable increasing demand for the labour market. It's a workforce, as a number of you know, that has particular characteristics. 93% women, 60-something% part-time, many of whom would like to do more work. Significant pay challenges, if I can put it diplomatically like that, as someone who represented aged care workers for 15 years. Significant pay gaps, for example, in the nursing area with public sector nurses, which causes recruitment and retention problems. Significant pay gaps in other relevant areas for PCAs, which are the larger bulk of the aged care workforce, and for indirect care workers as well. It is also a workforce that is ageing itself. It has a high average age, and so although those projections are out somewhat in terms of having to triple the numbers, this is a significant workforce that we are going to have to replace fairly soon. This is a very central part of the Productivity Commission's work that they're undertaking now. As you probably know, they issued a nice slim little document of 507 pages, a 50-page introduction, several hundred pages of appendices on the 21st of January as a draft report with 42 pretty far-reaching recommendations, many of which went to this workforce question. The need for competitive wages, the need for a much broader skills mix as the complexity of residents in aged care increases. This is a sector that was largely designed around the needs of physical frailty, but as needed now to deal with vast numbers of dementia cases, which carries with it increasing numbers of complex psychogeriatric cases. These are things that go to the heart of your work in terms of the skills mix that exists in aged care. For that reason, there are a number of initiatives underway that you're all familiar with, so I won't outline. Several $100 million of training money announced in the budget last year in 2010. ranging from some tens of thousands of extra training opportunities at Cert 3 and Cert 4 level, up to scholarships for nurse practitioners who we think, if we can get them in significant numbers, will play a very important role in dealing with some of those challenges into the future. So thank you for, first of all, the opportunity to come along here, but secondly for the really important work that this council does. The work you do is incredibly important and I look forward to our collaborative discussion for the next little while.